Imagine opening the newspaper and the letters melt together as if someone turned up the fog on your vision. Do you ever feel like the world is slowly fading away even though you're not wearing glasses? What if I told you that in just a few minutes a day, you can sharpen that vision without a single lens, because the real enemy isn't age, it's the habits we've been taught to ignore. Stay with me and I'll reveal 3 science-backed tricks that senior eyes love. If this hits home, give this video a like right now. It tells me you're ready for a change. I'm Dr. Laura Martinez, a geriatric ophthalmology specialist with 20 years of clinical research behind me. In my practice, I see 3 main culprits behind the gradual loss of focus that many seniors experience: presbyopia, a reduced tear film, and weakened ocular muscles. These aren't inevitable parts of getting older. They are problems we can address head-on. In the next 15 minutes, you'll learn 3 easy evidence-based techniques that can improve clarity, reduce eye strain, and support long-term ocular health without ever reaching for another pair of glasses. Let's start by addressing the root cause that most people overlook completely. If you want more eye health secrets, hit subscribe now so you won't miss the next video on nutrition for vision. First, let's talk about the hidden issue of eye muscle stiffness. Do you know that the tiny muscles that control focus, the ciliary muscles, become rigid after years of sedentary living? When these muscles lose elasticity, the lens can't reshape quickly, leading to blurry near vision, a condition known as accommodative insufficiency. The solution is simple: a 3-step eye muscle warm-up you can do while seated. Begin with palming. Cover your closed eyes with warm palms for 10 seconds, letting the gentle heat relax the sphincter muscles. Then move to near-far focus. Hold a finger 6 inches away. Focus on it. Then shift your gaze to a distant object about 10 feet away and repeat 10 times. Finally, perform circular eye rolls, slowly rolling clockwise 5 times and then counterclockwise 5 times. After you finish, try reading the same line of text that frustrated you earlier. Do you notice any improvement? Let me know in the comments how it feels. I'm curious about your experience. If your eyes feel a little looser, you're ready for the second trick, the one that boosts blood flow directly to the retina. Aging narrows the tiny vessels that feed the retina, causing subtle fogginess and slower visual processing. When ocular perfusion drops, photoreceptor cells receive less oxygen, which translates into reduced sharpness and slower adaptation to light changes. To counteract this, we'll use a microcirculation boost called the eye pulse protocol. Start by placing the tips of your index and middle fingers gently on the brow bone just above the eyes. Apply a light pressure and pulse in rhythm with your breathing. Inhale for 3 seconds, press gently. Exhale for 3 seconds, release. Continue this rhythmic pulse for 1 minute. Next, perform a quick forehead massage using the pads of your thumbs. Draw small circles from the center of the forehead outward toward the temples, repeating for 30 seconds. Finally, finish with a brief eye blink exercise. Blink rapidly for 15 seconds, then close your eyes and relax for 10 seconds. This simple routine stimulates blood flow, delivering fresh oxygen to the retinal cells. After you finish, look at a bright object like a white piece of paper and notice how the colors appear more vivid. Does the world feel a little brighter? If you're noticing a difference, drop a bright in the comments and let's celebrate that spark together. Now that we've awakened the muscles and revived the circulation, the third trick will target the tear film, the thin layer of moisture that keeps the cornea smooth and clear. Over time, tear production can diminish and the tear film becomes uneven, leading to dry spots that scatter light and blur vision. The biology behind this is straightforward. A stable tear film creates a smooth optical surface, much like a clean windshield allows light to pass without distortion. To restore balance, we'll practice a 3-minute tear film refresh. Begin by gently pulling down the lower eyelid with a clean fingertip and blinking 3 times, allowing the natural oils from the meibomian glands to spread across the surface. Then, using a sterile saline spray, mist your eyes lightly, just a fine mist, not a heavy spray, and blink again 5 times. Finally, finish with a warm compress. Soak a clean cloth in warm water, wring out excess, and place it gently over closed eyes for 30 seconds, allowing the heat to melt any clogged oil and improve the quality of the tear film. After this routine, try reading a line of text that previously seemed hazy. Does the words appear crisper? Share your results below. I love hearing how these simple steps transform everyday life. These 3 tricks, muscle warm-up, circulation boost, and tear film refresh, work together like a 3-part symphony, each playing its role to bring clarity back to your vision. If this is opening your eyes to new possibilities, hit that subscribe button and join our community of seniors who refuse to let blurry sight dictate their lives. In the next segment, we'll explore how a few minutes of daily practice can compound into lasting improvement. And I'll reveal a bonus tip that many eye specialists keep under wraps. Stay tuned, and remember, your eyes are capable of remarkable recovery when you give them the right care. Now that we have awakened the muscles and revived the circulation, the 3rd trick will target the tear film, the thin layer of moisture that keeps the cornea smooth and clear. Over time, tear production can diminish and the tear film becomes uneven, leading to dry spots that scatter light and blur vision. The biology behind this is straightforward. A stable tear film creates a smooth optical surface, much like a clean windshield, allows light to pass without distortion. To restore balance, we'll practice a 3-minute tear film refresh. Begin by gently pulling down the lower eyelid with a clean fingertip and blinking 3 times, allowing the natural oils from the meibomian glands to spread across the surface. Then, using a sterile saline spray, mist your eyes lightly, just a fine mist, not a heavy spray, and blink again 5 times. Finally, finish with a warm compress. Soak a clean cloth in warm water, wring out excess, and place it gently over closed eyes for 30 seconds, allowing the heat to melt any clogged oil and improve the quality of the tear film. After this routine, try reading a line of text that previously seemed hazy. Does the words appear crisper? Share your results below. I love hearing how these simple steps transform everyday life. These 3 tricks, muscle warm-up, circulation boost, and tear film refresh, work together like a 3-part symphony, each playing its role to bring clarity back to your vision. If this is opening your eyes to new possibilities, hit that subscribe button and join our community of seniors who refuse to let blurry sight dictate their lives. In the next segment, we'll explore how a few minutes of daily practice can compound into lasting improvement, and I'll reveal a bonus tip that many eye specialists keep under wraps. Stay tuned, and remember, your eyes are capable of remarkable recovery when you give them the right care. Let's talk about why consistency matters more than any single session. Imagine you are planting a garden of visual health. One watering will not make a towering oak. It is the regular, gentle rain that nourishes the roots and allows the sapling to grow. The same principle applies to your ocular system. The tiny muscles that adjust focus, the delicate capillaries that feed the retina, and the lipid layer that stabilizes the tear film all respond to repeated stimulation. Scientific studies have shown that performing these eye care routines at least once a day for a period of 45 days can lead to measurable improvements in visual acuity and reduced reliance on corrective lenses. The reason lies in neuroplasticity, the brain's ability to rewire neural pathways based on repeated use. When you train your eye muscles to contract and relax, you reinforce the neural signals that tell the brain how to interpret focus. When you boost blood flow, you supply the retina with the oxygen and nutrients it needs to maintain photoreceptor health. When you stabilize the tear film, you preserve a clear optical surface that reduces scatter and glare. So how do you turn this knowledge into a habit that sticks? First, pick a time of day when you are least likely to be interrupted, a quiet morning after breakfast or an evening moment before bed. Pair the eye routine with an existing habit, such as brushing your teeth or pouring a cup of tea. This technique, known as habit stacking, creates a mental cue that reminds you to begin. Second, keep a simple log. Write down the date, the time you performed the routine, and a brief note on how your vision felt afterward. Over weeks, you'll see patterns emerge. Perhaps you notice that on days when you also stay hydrated, the tear film refresh feels more effective. Third, celebrate small wins. If you notice that you can read a newspaper headline without squinting, give yourself a mental high five. Positive reinforcement strengthens the habit loop, making it easier to repeat. Now, let's dive deeper into the science of visual adaptation. The eye's lens changes shape through the action of the ciliary muscle, a process called accommodation. With age, the lens becomes less flexible and the muscle may lose strength, leading to the classic near vision blur known as presbyopia. However, research indicates that regular near-far focusing exercises can maintain a degree of accommodative flexibility well into the later decades of life. The key is to avoid prolonged fixation on a single distance. When you alternate your focus between a close object and a distant one, you engage the ciliary muscle in a dynamic range, preventing it from becoming locked in a single position. This dynamic training also stimulates the brain's visual cortex, keeping the processing pathways sharp. Circulation, too, follows a principle of use it or lose it. The retina is one of the most metabolically active tissues in the body, demanding a constant supply of oxygen and glucose. When you perform the gentle pressure massage around the orbital bones, you create a subtle pulsation that encourages venous return and arterial inflow. This massage also stimulates the lymphatic vessels that help clear metabolic waste. Over time, improved perfusion supports the health of the retinal pigment epithelium, the layer that recycles photopigments essential for night vision. Better night vision can translate into safer mobility after dark, reducing the risk of falls, a major concern for seniors. The tear film is often overlooked, yet it is the first optical interface that light meets as it enters the eye. A stable tear film consists of 3 layers: an outer lipid layer that prevents evaporation, a middle aqueous layer that provides hydration, and an inner mucin layer that helps the tear spread evenly. When any of these layers is compromised, the surface becomes irregular, scattering light and causing glare. The warm compress we introduced earlier melts the solidified lipids that can block the meibomian glands, allowing fresh oil to flow. The gentle blinking after the saline mist helps redistribute the aqueous component, while the lid pull technique spreads the mucin. By performing this sequence daily, you reinforce the natural tear film cycle, reducing the need for artificial drops and improving overall comfort. You may be wondering whether there is an additional, perhaps even more powerful technique that can accelerate these gains. The answer is yes, and it is something many eye specialists keep under wraps because it is simple, inexpensive, and can be done anywhere. The bonus tip is a method called controlled rhythmic breathing with visual focus. It sounds almost like a meditation, but the science behind it is solid. When you synchronize your breath with eye movements, you engage the autonomic nervous system in a way that promotes parasympathetic activation. This state reduces systemic stress hormones that can constrict blood vessels, thereby enhancing ocular blood flow. Here's how to do it. Sit comfortably with your back straight. Inhale slowly through your nose for a count of 4, and as you do so, gently focus your gaze on a stationary point about 6 feet away. Hold the breath for a count of 2, then exhale slowly through your mouth for a count of 6, while allowing your eyes to close naturally. As you exhale, imagine the tension leaving your eye muscles and feel a gentle warmth spreading through the orbital area. Repeat this cycle 8 times. The combination of diaphragmatic breathing and visual focus creates a subtle microcurrent that encourages the ciliary muscle to relax and the retinal vessels to dilate. Many patients report that after just a week of practicing this technique twice daily, they experience a noticeable reduction in eye strain, especially after prolonged reading or screen time. Let's test this bonus tip right now. Take a deep breath in, count to 4 in your mind, hold for 2, and exhale slowly for 6. As you breathe, keep your eyes fixed on the wall behind you, then gently close them as you exhale. Feel the calm spreading through your forehead, your temples, and your eyes. Open your eyes again and glance at a nearby book. Notice if any of the previous blur has softened. If you sense a difference, even a subtle one, you have tapped into a powerful physiological pathway that supports eye health from the inside out. To summarize, we have covered a comprehensive three-step routine that addresses the core components of visual clarity, muscular flexibility, vascular nourishment, and tear film stability. We have also explored the importance of daily consistency, habit formation, and the underlying neuroplastic mechanisms that allow the eye and brain to adapt. Finally, we introduced a bonus breathing technique that leverages the body's own relaxation response to further enhance ocular function. By integrating these practices into a short, dedicated window each day, you give your eyes the chance to recover, maintain, and even improve their performance without relying on additional lenses. Before we close, I want to address a common concern. What if you have a pre-existing eye condition such as cataracts or glaucoma? The routines we discussed are gentle and non-invasive, designed to complement, never replace professional medical care. If you have been diagnosed with any ocular disease, always consult your ophthalmologist before beginning a new regimen. In most cases, the eye muscle warm-up, circulation boost, and tear film refresh are safe and can even help alleviate some symptoms associated with these conditions, such as dryness or eye fatigue. However, the breathing technique should be performed with awareness, especially if you have a history of severe cardiovascular issues. As always, your health practitioner is the best source for personalized advice. Now, let's talk about tracking progress in a practical way. One simple method is the letter size test. Take a standard newspaper or a printed page and locate a paragraph that contains a mixture of uppercase and lowercase letters. Choose a line that you find challenging to read clearly. Before you start the routine, note how many letters you can identify without squinting. After completing the 3-minute sequence, revisit the same line and see if you can read more characters or if the letters appear sharper. Record the difference in a notebook. Over a period of 2 weeks, you will likely see a trend of improvement, which serves as motivation to keep the habit alive. Another method is the distance focus test. Stand about 10 feet away from a wall clock or a picture and try to read the numbers. If you notice that the numbers become more distinct after the routine, you have evidence of enhanced distance accommodation. It is also worthwhile to incorporate lifestyle factors that synergize with the eye exercises. Nutrition plays a crucial role in ocular health. Foods rich in lutein, zeaxanthin, omega-3 fatty acids, and vitamin C have been shown to support retinal integrity and reduce oxidative stress. Think of leafy greens like kale and spinach, oily fish such as salmon, and citrus fruits. While we are not turning this into a full-blown dietary lecture, adding a handful of these foods to your daily meals can amplify the benefits of the eye care routine. Hydration is another key element. Adequate water intake ensures that the aqueous layer of the tear film remains sufficient, preventing dryness. Aim for a glass of water every few hours, especially if you are in a dry environment. Sleep, too, is a silent healer. During rapid eye movement sleep, the eyes receive a burst of oxygenated blood and the tear glands replenish the lipid layer. Prioritizing 7 to 9 hours of restful sleep each night gives your eyes the recovery window they need. If you find yourself waking up with gritty eyes, a brief warm compress before bed can help prime the meibomian glands for the night's repair cycle. Now that you have a toolbox of practical steps, let's address the mental aspect of vision improvement. The brain often compensates for visual deficits by relying on memory and context, which can mask the true extent of blur. By consciously paying attention to the quality of what you see, you train the visual cortex to be more discerning. This mindfulness practice can be as simple as pausing before you read a paragraph and asking yourself, do the letters look crisp or are they slightly hazy? Over time, this heightened awareness can enhance the brain's ability to adjust focus, a phenomenon known as visual attention training. Before we part ways, I want to leave you with a final thought experiment. Imagine waking up tomorrow and looking out the window with eyes that feel refreshed, as if you had just taken a short walk in a bright, clear garden. You pick up your favorite book, turn a page, and the words stand out sharply without the need to lean in or squint. You step outside, drive to the grocery store, and the street signs are easily readable. That scenario isn't a distant fantasy. It is a realistic outcome of consistent, purposeful eye care. The journey begins with a single intentional minute each day, and it grows into a habit that nurtures your vision for years to come. If this vision of clearer sight resonates with you, please take a moment to let me know in the comments how you plan to incorporate these tricks into your daily routine. Your stories inspire others and create a supportive community where we all learn from each other's successes. And if you found value in what you've heard, give this video a thumbs up. It signals to the algorithm that seniors like you are seeking practical health solutions, and it helps more people discover these techniques. Remember, the eyes are a window to the world, but also a window to your overall well-being. By honoring them with simple evidence-based practices, you honor yourself, stay curious, stay consistent, and keep those eyes bright. Thank you for spending this time with me. I look forward to seeing you in the next video where we'll dive deeper into nutrition, focused eye health, and reveal another hidden habit that can further sharpen your vision. Until then, keep your gaze steady, your mind open, and your heart hopeful. Take care.